if I tell you about this paced world in which everybody is like running, so the erectile dysfunctions has now become a pandemic. First of all, this is the most searched item in the internet.
That's right.
But is the least talked about in our clinical practice. So in the last 2 decades, if I'm not mistaken, so there has been a shift in the population age group who are suffering from the kidney stones. Initially, we used to get a lot of patients who are in their late 40s and 50s who are suffering from kidney stones. Now we are getting patients who are in the early 20s and 30s, especially some young infants. So whenever I tell all my patients that best parameters to judge whether you are underhydrated or overhydrated is the color of your urine. Those who are on multiple medications, those who are obese, these subset of the patients need regular follow-up. By regular follow-up means that they need to consult the urologist every 6 monthly, even if they are asymptomatic.
Hello and welcome to Health Talk, where we bring in the experts from the industry in the field of healthcare, wellness, and healing. I'm your host, Vishal Kumar Laroya, taking you through the journey today. Today's topic we're discussing is where the people are affected across the world, but very less people talk about it. Yes, we're talking about urology. To discuss it further, we have Dr. RF with us, who has years of experience in robotic surgeries as well as the laparoscopic surgeries. So we welcome Dr. Arif to the show.
Thanks, Vishal. So let me explain you what exactly is a urologist. Who exactly is a urologist? So first of all, we need to know there are multiple subspecialty in a medical practice, and so the urologists are the clinicians or the surgeons who are having extensive experience with the male and the female genitourinary tract, as well as the male reproductive organs and their disease. Now, if I tell you what exactly is the genitourinary system, so it starts with the kidney, with the ureter, which carries the urine, and then into the bladder, the prostates, as well as the male sexual organs, especially the penis, the testicles, and of course, the connections or the where the sperms are being produced. So we deal with a lot of male sexual organs as well as the female urinary systems. So we deal with, to begin with, the kidney. Like in the kidney, we deal with a lot of kidney infections, kidney stones, surgeries related to the kidney cancer, surgeries related to the bladder cancer, surgery related to the prostate cancers, as well as we also deal with the kidney transplant. So we are the surgeons who perform the kidney transplant. So basically, if we talk in what you call in summary, then the urologist is a urosurgeon who specializes in genitourinary system as well as the male reproductive organs.
Thank you, doctor. Now, as we discussed, the basic problem which we find most of the people have are the kidney stones. And the urologist has a major role in helping them out. So I want you to explain to our audience about how the kidney stones are formed in brief, and what kind of surgeries options are there, and what are the how we have evolved as a technology in doing these kind of surgeries.
So let me explain you first what exactly the kidney does and how the kidney stones are formed. So the primary function of kidney is to filter the blood. Now, by filtering the blood means that whole of the blood in our body is filtered through or it's cleaned through our kidneys. Now, whenever there is an increase in the concentrations of some byproducts, suppose like oxalate or calcium or uric acids or some other metabolic abnormality, the filtration capacity of the kidney decreases, and therefore it start filtering more of certain substance which generally crystallizes inside our body. Now that is the main reasons why some of the kidneys form stones while the other do not. So the primary reasons why we are forming stones in the kidney is the kidneys are not adequately hydrated. That is, we are not having adequate amount of water that we need to have. So in the last 2 decades, if I'm not mistaken, so there has been a shift in the population age group who are suffering from the kidney stones. Initially,
Okay.
we used to get a lot of patients who are in their late 40s and 50s who are suffering from kidney stones. Now we are getting patients who are in the early 20s and 30s, especially some young infants, like in their first 1 to 10 years of age group,
Okay.
that are suffering from kidney stones. So the primary reason why some individuals are forming more stones as compared to the others is like the first and the foremost, their water habit is very much disturbed. By water habit, we mean to say that there need to be an adequate amount of water that the person needs to drink every day.
Okay.
That every day, and it should be equally distributed throughout the hours of the day. So the minimum requirement depends upon a lot many things, like what is the weight of the patients, where he is living. Like if somebody is living in a hot and humid climate, he needs to drink a lot of water more
Yes.
as compared to someone who is living in a cold environment.
Mhm.
So if I say the minimum amount of water one should have is almost like uh, 2.5 to 3 liters. That is the minimum. And one of the important gauge or the parameters in which we tell the patients that he is adequately having amount water is the color of the urine.
Yes, right.
Suppose the color of the urine is pale or pale yellow or darkish yellow, that's mean that individual, that person, that patient is having lack of water. That is, he is dehydrated. That's the reason why the kidney forms pale yellow or darkish yellow color of urine.
Okay.
So whenever I tell all my patients that the best parameters to judge whether you are underhydrated or overhydrated is the color of your urine. So the most important thing is you need to have adequate amount of water. Now there are certain substance, or in brief, which I say that will leads to more incidence of kidney stone formations. So these substances are, if somebody is taking a lot of animal proteins, somebody is taking a lot of coffee, uh, somebody is taking more of caffeinated drinks or chocolate or broccolis or mm, uh, junk food constitute a lot of our new age food habit.
Mhm.
So those individuals who are very much involved in having junk foods throughout the weeks or the month are at the increased risk of kidney stone formations. Now I generally recommend that whatever food we eat generally leads to kidney stone formation. So the dictum or the mantra is you need to have a lot of water with everything under moderation. So that is the mantra which I want to tell the audience today is you need to have adequately hydrated and have less amount of the foods which lead to kidney stone formations. So that is the mantra today.
That's nice. Now, from kidney stones, what we discussed now, to moving on to a patient suffering from a renal failure, a kidney failure. So what kind of patients do you normally see, and what are the recommendation, and what are the line of treatments available for them?
That's a very important question. Now, what I am telling you right now is with my 15 or 20 years of experience in this field treating kidney stone patients. Now, the thing is, I'm seeing a lot of patients who are like neglected or because they don't know, they are not well educated about the kidney stone problems. So I see patients generally who is taking alternate medicines. They know that they're suffering from kidney stones, but they are into alternate or the herbal medicines, and somebody has told them that the kidney stones, I will give some medicine that the kidney stone will dissolve. So believe me, there is no medicine in this world which can dissolve the kidney stones. So neglected kidney stones is the major cause of the kidney failure right now in certain part of India as well as in throughout the world. Now, a neglected kidney stones means, suppose you know that you are suffering from kidney stones and you are not getting any treatment for that. Depends upon so many things, like what is exactly is the size of the stones, whether the kidney stones are associated with infections or not, whether there is an obstruction because of the stones or the kidneys is obstructed. Obstructed means there is a blockage to the urine passage. So all these can contribute to failure or the kidney failures or kidney non-functioning in those kind of patients. Special precautions which I need to tell you right now about some patients or some category of the patients which they need to have a regular follow-up with urologists. These are the patients who are like diabetic, who have a repeated bout of kidney stones in the past, or a repeated history of surgeries for the kidney stones in the past. Those who are on multiple medications, those who are obese, these subset of the patients need regular follow-up. By regular follow-up means that they need to consult the urologist every 6 monthly, even if they are asymptomatic, and just get an ultrasound or any imaging modality within at least twice a year. This is very important. Now, the whole realm of the surgical intervention in the kidney stone patients has drastically changed in the last 10 years. Now, initially, what we used to do is make a large cut. Nowadays, we have surgical options in which it's a completely no cut, no stitch surgeries. That is endoscopic surgery, and depending upon whether there's location and what is the size of the stones, we can individualize the treatment protocol. Now, by individualizing the treatment protocols means there are almost like 10 different ways in which we can treat the kidney stones. So depending upon whether there's stone burden, how much is the stone burden, where is the location, whether there is an associated abnormality with the kidney, we can either go for RIRS, which is a complete endoscopic procedure, or we can go for RIRS, means that is we go in through the scope, we break the stone with the laser, and we remove the stone in the form of the dust. Now, there's another method in which we call it a percutaneous approach. We call it a PCNL in general word. Now, the PCNL over last 10 years have graduated into mini PCNL, ultra mini PCNL, micro PCNL. So this has all arises because of the miniaturization of the instrument we have, and different type of very effective laser treatments that we have. So in summary, the kidney stone surgery is very effective, and we are able to remove all the stones. In along with it, we are able to protect the kidney even if there's a small stones. Now, most of the kidney patients or the kidney stone patients do not need treatment for all stones category. This is the myth that even if I have a 2 or 3 stones, we need some treatment, or we will be needing some surgery. So any stones which is less than 4 in our clinical practice, we call it insignificant clinical stone.
Okay.
So all of these less than 4 or 5 stones need not to have surgical intervention to be done. They can be managed with some medicines that help in the expulsion of these stones from the kidney. Now, for all those stones which are complicated, that is complicated with the infections or deterioration of the renal functions or associated with the blockage in the urine pipe, then we have to go for the surgical intervention. So in summary, these are the various options available today, and we have gradually over last 10-15 years, from the open surgeries to minimally invasive surgeries and to no cut, no stitch surgery.
So, doctor, in today's world, there's a big myth that that if you have a kidney stone, you don't need to go to a urologist. Have a glass of beer, a couple of beers. It's a good weather to have it, and it's gonna flush out that kidney stone. I know as a doctor you may not be accepting it, but you must have heard about it from your patients. So, what's your intake on that?
So the biggest myth is you are getting a consultations on Google, and your consultation from your relative or your friend saying that I had a kidney stones, and the doctor told me to have a 2 to 3 pint of beer, and then it will get expelled out from your body. Now, I say this is the most dangerous myth we have in our clinicals, or in our clinical setup, or in our society. If I tell you that the beer is the worst form of any drink we can have right now,
Okay.
especially in a kidney stone patients. Now, the beer has very high oxalate concentrations, and about 60 to 65% of all kidney stones are made of calcium oxalate. So what does the beer does to our body? It increases the total urine output. It is most of the time acts like a diuretic. So
Right.
what happens is your urine production increases, you feel dehydrated. So the small stones or 1 or 2 stones may be getting flushed out from your body, but long term, or the patient or a person who is having a lot of beer will ultimately end up forming more of stones, because the oxalate concentration in beer is the highest of all the alcoholic and non-alcoholic drink. So
Okay.
this is the biggest myth, and this has led to many of the patients complaining or suggesting to me that, okay, doc, I had a pint of beer. Now the worst thing with the beer is the beer leads to dehydration, because it leads to uh, excessive urine production. So if you are not getting it compensated with the same amount of water, then your kidney is again dehydrated, and then you can have a repeated bout of pain or a symptoms related to kidney stones. So this is the biggest myth which the general public need to be aware of.
Yes.
So the beer is the worst form of any alcoholic or non-alcoholic drink.
Thank you, doctor. To bust that myth was very important.
Yeah.
Now, let's talk about another area where a lot of people are suffering across the world. Not only we talk about in India, we talk about people in Africa and other nations, are the people suffering from the prostate disease. So, if you explain what is a prostate disease and how it can be identified, and what could be the cure for them.
So let me explain you from anatomical and the physiological and the pathological aspect what exactly is the prostate, what is its function inside our body, and what are the symptoms the patient can have related to the prostate, and how many percentage of the patients in different age group can have symptoms which is related to the prostate,
Okay.
and what are the main disease that the patients can be affecting from the prostate. So the prostate is very small shape size gland, which is almost of the size of a walnut. So the primary function of the prostate is reproductive functions. So it produces certain substance and the serum in which our sperms survive. So the primary function of the prostate is to produce certain substance which help in the vitality and for the longevity of our sperm. Now, with age, just like the females have a menopause, with age, there is certain changes in our body in the terms of hormonal changes, which leads to gradual increase in the size of the prostate.
Okay.
Now, this happens with the age. If I break it down into different age group, suppose 50% of the patients in the age group of 50 will have some or the other symptoms which is related to the prostate enlargement.
Okay.
And that percentage increased to 60% by the age of 60 years, 70% by the age of 70 years, and 80% by the age of 80 years, and 100% by the age of 90 years.
Okay.
Now, the most important myth, or which every patient comes to me and tell, doctor, I have this prostate and it is causing a lot of problem. But my friend was having bigger prostate and he's not having any symptoms.
Yes, true.
Now that need to be understood that the size of the prostate has nothing to do with the severity of the symptoms in any age group.
Okay.
Of course, when the size increases to a very large size, then it can definitely leads to some or the other symptoms related to the prostate. Now, I will explain what are the symptoms which men should be taking care of and should be aware of related to the prostate.
Yes.
The first and the foremost is increase in the frequency of urine. Frequency means that how many times during the day and how many times during the night they need to get up and go to loo. And this is the most common symptoms.
Okay.
We call it irritative voiding symptoms. Now the other is the urgency to go to loo or urgency to go to washroom. So the urgency means that you have a sensation and you cannot hold the urine, and by the time you go to the loo, there is a very strong urge and some of the urine leaks. We call it urge incontinence. So the one other very common symptom is nocturia. Nocturia means that the patient has to get up during night time at least twice or more than twice during the sleep time. That is the most bothersome of all the symptoms. Now, some other symptoms are also associated with the prostate enlargement in general. That is a deterioration of the urine flow rate. That is, the stream in which we passes urine has decreased or deteriorated over a couple of years or say month. This is the other symptoms which the patient can have. A sense of incomplete voiding, that is, He goes to loo, he passes some amount of urine, and then again within half an hour that he again have a sensation that he needs to go to loo again.
Right.
So that is the sensation, we call it incomplete voiding symptoms. The other thing is, whenever he is able to pass urine, he need to strain a bit, but the in the initial part of the urination, that stream improves but gradually deteriorates.
Okay.
Now, these are the common symptoms. Now, sometimes the prostate enlargement can also lead to complications like blood in urine, which is an alarming sign. Second is the formation of a stone in the bladder, if there is incomplete emptying or there is an associated infection, or there is a recurrent bout of UTI in males.
Okay.
Males do not get UTI
Is it?
as compared to the females counterpart. But if the male patient who are aged, who are diabetic, are getting repeated bout of infections, then definitely we have to get to see whether the prostate is chronically infected. We call it a chronic prostatitis, or the prostate is the culprit.
Okay.
So all of these symptoms comes into the category of complicated prostate related issues that need to be taken care of. And if at all any of the beyond 50-year-old male is having all these symptoms, that you need to consult a proper urologist and get a consultation with me and evaluate your prostatic health. Now, men are in the habit of not going to the urologist. Yes. Because of social dogma, because he considers themselves to be a superior race, or and there are a lot of responsibility which are associated with the men. So I see a lot of men who ignore these kind of symptoms, and ultimately leads to complications, and then they consult the doctors. So if I talk about the screening protocol, so the normal screening protocol throughout the world, whether it's in India or in Africa or any part of the any country of the world, is you need to have a minimal first hand evaluation of the prostate at the age of 50.
Okay.
In some of the countries like Africa, or in those patients who had a history of cancer prostate in their families, like in father or the brother, these evaluations need to be done at 40 years of age. So the initial protocol is we need to assess about how bothersome the symptoms of the prostate are.
Mm-hmm.
Then we will have to evaluate physically how big is the prostate, what is the anatomy of the prostate. Then we will have to run some urine test and some blood tests. Okay. Now, amongst the blood tests, the most important is the serum PSA level.
Okay.
So the baseline PSA level should be done in every man at the age of 50. Now, in those men who had a family history of cancer prostate, the serum PSA need to be done at 40 years of age. Or in the African individual, that need to be done at 40 years of age.
Okay.
So if you have any family history of cancer prostate, or you are from an African background, then you have to do the evaluations at 40, and the baseline serum PSA need to be done at 40 years. Some of the books or some of the literature says that the first baseline PSA should be done at 45. But these are like individual practice. But the guideline says that if you are suffering from the prostate related problems, even if you are not suffering, just like in females we do the screening for cancer breast and cancer uterus. So just like that, we do the screening for the cancer prostate, and that screening begins at 50 years of age.
Now, continuing to what you said, doctor, when you said prostate cancer, so is a patient suffering from the cancer, prostate cancer, will go to an oncologist or an oncosurgeon, or it's going to be the urologist who's going to help them out?
No, the thing is, you need to understand. So if I tell you about the prostate cancer, it is one of the few indolent cancer. But overall, it is the second leading cause of mortality in men after cancer lung. Okay. So the evaluations and the management is basically a multidisciplinary approach. Okay. So if somebody is a newly diagnosed case of cancer and the cancer is localized to the prostate alone and it does not spread to any part of the body, then the primary surgeon who takes care of that part of the that cancer management of the cancer prostate is a urologist. Okay. Is a uro-oncologist. Now, as I have already said, that the cancer prostate is a very indolent cancer. And the symptoms of the prostate cancer generally merges with that of the prostate enlargement. So the urologist or uro-oncologist is the best person who can differentiate between whether these symptoms are related to benign enlargement of the prostate or it's a cancerous enlargement of the prostate. So this is very important because not all increase in the serum PSA are cancers, and no serum PSA levels is safe PSA level. So the first person or the first surgeon you need to consult with the cancer prostate is a uro-oncologist or urologist. Then he will evaluate and run a battery of the test depending upon your symptoms, depending upon your clinical parameters, your blood levels, urine level, and then he will assess whether the cancer is localized to the prostate or it has spread beyond the prostate. Now, when the cancer is localized to the prostate, the treatment of choice is the removal of whole of the prostate. We call it radical prostate surgery. Now, when it has gone beyond the local prostate area, then it becomes a multidisciplinary approach. Now, there is a role of surgery even in advanced localized cancer prostate. Then there is a role of hormonal therapy, there is a role of radiotherapy, then there is a role of chemotherapy, and then it becomes a multidisciplinary approach. Then there is a radiation oncologist who take part in that, and there's a medical oncologist who take care of the chemotherapy or the hormonal therapy, and there are certain recent target therapies and molecular therapies that has come in the cancer prostate management. So for the initial part, when the cancer is localized, the primary aim of the management is to cure. But when it has gone beyond the cancer, the prostate area, the intent is palliations or to prevent the spread of the cancer beyond that area. So that become a multidisciplinary approach, and then there comes the role of cancer board or the cancer committee on cancer prostate. So we have a multidisciplinary approach to cancer prostate, even if it's diagnosed in the very early part when it's localized, and we do the surgery, and then they need to be follow up that we do according to the cancer board recommendation.
Now, a topic which has not been discussed, topic which is, I believe the patient would not come to you mostly for the discussion and is searched a lot on the internet, is an ED, erectile dysfunction. Now, before coming to a urologist, I believe you must have seen a lot of patients in the OPDs, but they must have tried some alternatives a lot before eventually ending up with a doctor. When you recently said that there's a lot of males who does not go to a urologist to discuss further what kind of line of treatment, so they do a lot of self-medication. So what's your take on that, and what is a treatment option available for them?
So this is very important in the sense that if I tell you about this paced world in which everybody is like running, whether it's a corporate target, aims, or our individual aims in our life. So the erectile dysfunctions has now become a pandemic. Now, by saying a pandemic, that initially the erectile dysfunctions, first of all, this is the most searched item in the internet.
That's right.
But is the least talked about in our clinical practice.
Yes.
So there are certain reasons why this is happening. So there's a taboo which is attached. There comes the role of male ego that no, I'm not suffering from erectile dysfunction, so I will not talk to my urologist or andrologist. So these are the main reasons, and because we are all preoccupied or involved in so many of our targets, aims, and we forget about this erectile dysfunction. Now, this erectile dysfunction, if I talk about the stats and data throughout the world, or in India per se as in particular, so this is now has become a pandemic. Now, a pandemic means is every 30 to 40% of the individual in the age group of 30 to 40, they are suffering from erectile dysfunction. Now, that amounts to a very huge number.
Huge numbers, right.
But only less than 0.5% of those individuals are talking about these problems.
So what are the
And that is the reason why I say that the younger individuals, even if they are having some degree or the other of the erectile abnormality or dysfunctions, they are suffering in silence. And then they keep on searching about medications. Those are self-medications. any herbal product. I don't have any disclosure to make about any herbal product or any alternate medical systems or a medicine for the erectile dysfunctions. But believe me, that is the most searched item on the internet today, and they are using over the counter drugs without knowing that what exactly is the cause of this erectile dysfunctions in them.
Right.
Now, I will generally categorize erectile dysfunction in male in broad two category. One, 33% will be having some of the psychological issues that ultimately leads to erectile dysfunction. They're stressed out, there's anxiety, there are certain targets in their office that need to be met, so they don't have time, they have a very unhealthy eating habits, so they are suffering from cholesterol problems, they are having high blood pressures, or some of them are even having diabetes. All this can lead to erectile dysfunction.
Okay.
Now, there are 33% of the patients who are having an organic cause of the erectile dysfunction. That is, there is a disease which is related to the cause of the erectile dysfunctions. And another 33% of the patients will have a combination of both. That is, a psychological reasons, a culprit, and the medical or the organic problems that lead to erectile dysfunctions.
Right.
So, this is the least talked about and the most searched about topic. But we are not, even in fact, all the men, in whether they are in the early 30s, 40s, 50s, they don't want to talk this thing about themselves because this will hurt their ego. This is the male ego.
Right.
And that is the reason why I always say they are suffering in silence. So we need to speak out. We need to make it a habit that even if you are having a minimal amount of erectile abnormality, I will not say the dysfunctions, but definitely that need to be talked about. And there is a definite proof that it can be treated adequately. So my mantra for this session will be: you talk about this thing and any problem you are facing in your sexual health or the sexual life with your urologist and urologist.
Right. So, being a urologist, what are the line of treatments do you offer to the clients? And extensively, we will discuss about it further.
So, the first thing first, what we need to do about erectile dysfunctions, you go and you talk to your urologist and andrologist. Now, as a urologist and andrologist, what I do in the very first session, that I will listen to you. You know, I have told the men have never been listened to. So I will listen to you in the very first session. I will just try to evaluate how much he is suffering from, how much stress is there because of the erectile abnormality, what are the conflict and what are the disagreement in their sexual life and with their sexual partners. And for the initially 1 or 2 sessions, we do the counseling part.
Okay.
So there is no medicine, no surgeries in the initial those days, in which we try to evaluate what the root cause of erectile dysfunctions. So this counseling period is very important. So improve and empower and encourage their morale, their thinking, and then the patient open up. Then he will try to explain so many things, that I'm having this problem at my office, I'm having this problems with my partner, I'm having a lot of issues related to, so I'm not thinking about the erection abnormality I'm facing. So this counseling session is very important. The next step is, we, even if that is not happening and that is not helping that patient, then we will give some medicines. So all of these medicines are very structured medicines, and these are like these medicines need to be customized to the individual need of the patients. That does not mean that the patient goes to a pharmacy or a counter and took some medicine, random medicines, because these medicines are dangerous medicines. In case these medicine can have multiple side effects and some serious side effects. So all of our patients is not a candidate for these medicines. Some of the medicines are generally boosters, or we call it supplements, and some of the medicines are specific target medicines.
Okay.
And these medicine has got serious side effects and serious risk associated. So what you need to not to do is get over the counter medicines and pop in, pop out every time you can have an episode of erection abnormality. The second step is some devices we generally put in to help with the erections. Just we have like a vacuum erection device. Now, the last step is the penile implant surgeries. Now, the penile implant surgeries are indicated in those patients generally who are not very well satisfied or not very much happy with the medications or any assisted erection devices.
Okay.
Now, erectile dysfunctions is, I'm not saying that every patient with erection abnormality will have to have penile implant surgeries. Now, there is a subset of the patients who are not getting any benefits whatsoever from the medicines or a assisted device. Then we generally ask them to get evaluated for the penile implant surgeries. Now, we have graduated in the last 10-15 years with variety of the different penile implants that is individualized and customized to the patient need.
Okay.
So we have Indian penile implants, we have multiple European penile implants, we have American penile implants, and all these penile implants generally provides the patients with the highest level of sexual satisfaction, and most of them are not associated with any risk or the complications that are associated with the medications or the long-term medications.
Okay.
Okay, and these are very customized to the individual needs, and we individualize the what type of implants generally we can have on that patient. So these are some of the summaries in which we evaluate the patients. We generally ask for the management regarding the treatment protocols. So this is very important that each individual or each patients who are having a problem with the erections and difficulty in their sexual health need to be evaluated individually, and the individual needs need to be taken care of in the form of medicines, in the form of assisted devices, or in the form of penile implants.
Okay. To sum it up, doctor, what's your advice for your patients who have suffering from multiple problems, but they do not have a solution, or even they have a solution, they don't want to opt for it? Especially as you said, the most thing they discuss about is going over to the internet and search about it, and come up with their own conclusion, their own self medication, their own thinking, not visiting a doctor. So what's your input on that, and what's your message to people?
So the most important thing in the world where artificial intelligence has grown up to a point that most of the work out in our daily life are being done with artificial intelligence or AI.
Right.
So the thing is, you need to understand the difference between a physician, a surgeon, and the all of these platforms. So these are education platforms. They are generally, even in the last, if you keep on searching on Google or any search engine or any AI platforms, they will keep on that these are the recommendations basis on the basic on the basis of or based on the data or the research that has been going on for the last 40, 50, or maybe a century.
Right.
They will only give a overview picture of that thing. Now, the thing is, they do not provide for the treatment, and that is not a treatment platform. So, what a urologist does, which is different from the AI or the search engine, is the search engines, whether it's a Google or whether it's any AI platform or the Chat GPT in particular, which is very favorite amongst individual right now, is that gives an overview or a picture of your problems. Now, the thing is, you cannot replace a urologist or neurosurgeon or andrologist with the AI platform. The reason is, they will not listen to you. The most important thing, as I have told you, is men in particular do not open up to, and they do not seek help.
Right.
So what they will do is they will keep on searching, they will keep on suffering, and they will do things which will further deteriorate their conditions or the suffering, and ultimately they will land up in a position in which the urologist or neurosurgeon and me as a particular, if your erection abnormality or the cancer prostate or any malignancy is concerned, will land up in a positions in which we also will have a limited hand. So what you need to do is, whether you are suffering from any disease, whether kidney stones or erection abnormality or any prostate related symptoms or any kidney problems or any urine problems, don't keep searching on the search engine or the AI platforms. They will only give you overall pictures, and they will give a summary. You may be suffering from cancer, or you may be suffering from, just like I have told you,
So that's
that
generalized.
the most searched item is the UTI that leads to, suppose the person is suffering from burning micturations. So what I tell all my patients is, every burning in urine is not infection. There should be a underlying pathology why you are having burning in urine, you are having difficulty in passing urine, while the other does not have. So every burning in urine is not UTI. Every pain in the back is not, which is something related to your spine. Every pain in the back or the lower back has nothing to do with your bones. These need to be evaluated. Now, the search engines or the AI platforms will guide you regarding the initial, depending upon your queries and your prompt. Now, that prompt is very important. So, these platforms will only guide you to the point in which you have asked in the form of prompt. Now, the doctors differ that they will inquire about, there will be a sense of sympathy and empathy in the doctor's treatment or counseling in that sort. So the most common reasons while the people suffer in this internet era is they keep on searching on internet, they keep on searching on various search platforms and the AI, and believe me, that is the root cause of 80 to 90% of the disease getting progressed, worsened, and inoperable at some time.
Right. So in nutshell, you say that these platform can be used for an educational purpose.
Yes.
But eventually you have to go and consult your doctor.
Yes,
for further
that need to be a
information.
physical consultation. I'm not saying you come to anybody specific, but you need to have a physical consultations.
Correct.
It is your body. It is not just like a guinea pig sort of a thing that you can keep on researching or experimenting on your body. It depends upon the finding which you get on internet.
Right. So thank you, doctor. Thank you so much for your insight about the various aspects in urology, and I hope our patients get more information. They get to know, and we continue with more information with more doctors at the later stage. Thank you, everybody.